And I'm Kim Winter, and we are into the second half of Otherwise here. And Karen Moss, she's sitting opposite me in the studio today. Her son was born with bilateral clubfoot, and challenged with little support and information available in South Africa, Karen travelled to the States to find help. And she found it in Dr. Ponsetti, who not only helped her fix her son's feet, but also motivated her to start her own charity, Steps. It's so lovely to have you in studio.
Thanks for having me.
Right, I think we should start with you taking us back to the beginning, your story.
Okay, well, my son was born 10 years ago in 2003, and I didn't know until he was born that he had club feet. It wasn't diagnosed, so it was a huge shock. And we followed the protocol of treatment at the time, which was surgery for over 80% of children, which is quite radical surgery, opening up the foot, moving pins around, and the long-term prognosis would have been scar tissue, arthritis, possibly problems in the joints and the hips and the knees. And I, by pure luck and serendipity, I suppose, found this amazing 89-year-old Spaniard who was an orthopedic surgeon working in Iowa, and he had developed this technique 50 years before to gradually and gently correct the club foot by using serial casts. So every 3 to 5 days he would change the cast and reposition the foot. By the end of 4 to 6 weeks, and just about every club foot is straight from that, and there's no surgery required. The only surgery that is required is a very little short snip the back of the heel, which can often be done under local anaesthetic, as it was for my son. And I contacted him by email, not even knowing if he was still practicing, because I'd read that he was developed in the 50s, and he answered me, and I phoned, and he said, well, can you come? When can you come? I'll fix your son's feet. So, of course, in between panic and and happiness, we managed to get together and fly across to Iowa. My husband, Steve, and Alex, my son, and I. Alex was 10 weeks old by then. He'd had 8 casts in Johannesburg, which were unsuccessful, and he'd already been scheduled for surgery. We went to Iowa, met Dr. Ponsetti, and I knew straight away that we'd made the right choice, because the whole experience was just so much more calming. It was very centered around the mother and calming the baby and explaining everything to me, what was going to happen. And literally, when the first cast had been taken off 5 days later, I was astounded by the amazing change in his foot already. And within 2 more casts, his feet were straight. So I got home, cancelled the operation that he'd been scheduled for, and told the doctor that his feet were straight. What had happened when I was in America, I asked Dr. Ponsetti, if you've been doing this since the 1950s, why did I have to fly all the way here? Why aren't there doctors doing it in South Africa? So he said that I was the first South African that had been to his clinic, and he suggested, he said that he was a great believer in the power of parents, and especially mothers, in knowing what was right for their babies and the drive that mothers have to get the best treatment for their babies. And he said, well, you're going to have to go back to South Africa and take my method there. So I came back with my child with straight feet and no medical or NGO experience whatsoever, and that was 10 years ago. And I'm pleased to say that I've had great support from various people, including the medical community. We had our first training, which I organized in 2006, and brought 3 orthopedic surgeons from Europe, America, and South America to train our doctors. And it's now the approved method in the country. It's been endorsed by the South African Pediatric Orthopedics Association. And what makes me extremely proud is that next week we're flying to Gaborone, and I'm taking the method there with doctors that I trained in 2006.
Fantastic.
So we're spreading it into the region. And next one after that will be Namibia. And when I see the patients and the treatment that they're getting compared to what they had in the past, there are challenges, but it's just so gentle and effective that it really is. I'm really pleased that it has gone this far already.
So it wasn't only that Dr. Ponsetti looked at you as a mother and a person, not just as a victim or a patient, but this little one in trouble, but his method was completely different to what's being done, but it sounds like on this continent anyway.
Yes. Ironically, it was already available in Uganda and Malawi, because 2 doctors had taken it there, but it wasn't available in South Africa. They had started it about 2 years before I found Dr. Ponsetti in Uganda. And I think the difference was, first of all, when he had the treatment in South Africa, it was only one person doing it. With the Ponsetti method, there's a doctor and an assistant. and the mother concentrates on calming the baby down and making sure they don't cry during casting. It doesn't hurt the baby, but it's like all babies will scream if you put them in the bath, scream if they take their clothes off. So it's a way of, they advise you to take your baby hungry to the casting so that you keep them distracted. Whereas the first casting we had, I was part of it. I had to hold my baby's knee and pull his toe, and I mean, he was 7 days old. It's quite stressful for a mother to do that, and the baby was screaming and he was never calmed or comforted. It was just a much more holistic and easier experience for me comparing the two, having had both.
And in South Africa, is there a large number of babies being born with clubfoot? And what exactly are the causes of clubfoot?
Well, they're still trying to work on what the actual causes are. There's been a lot of studies in America and in England and Scotland as well. But no one has come up with a definitive cause for clubfoot. It's just classed as environmental and genetic combination. It does run in some families, but then there'll be an isolated incident. Twice as many boys and girls have clubfoot, and more than half of them have patients have both club feet. Sometimes you can have one clubfoot. It's normally about 65% are bilateral, which is what my son was. And in South Africa, it's interesting to note that we have the second highest incidence in the world, us and Southern African and East African region. In fact, Sub-Saharan Africa has got the second highest of clubfoot incidence. The highest is in Polynesia. We don't know why as well, and the lowest is in Japan. But the world average is about 1 in 750 to 1 in 1,000, and we are 2 per 1,000 minimum, sometimes 3, depending on what studies you read. So there's a huge need for it in this population. And I would say that 90% of patients are in the state clinics, and they do get free treatment because they're under the age of 5 for clubfoot. But it can vary from hospital to hospital, depending on who's available, what staff complements they have and that type of thing.
Can you identify that your baby's got clubfoot quite easily? I mean, what are the signs?
Yeah, it is quite easy. It can be picked up in utero before the baby's born, if you have sort of high-tech x-rays. I had them and they didn't pick it up. But what normally will, sometimes a child has got toes pointing in, so people think it's a clubfoot. It's not, because that's normally quite flexible. Clubfoot is quite stiff, and it is not just from being cramped in utero. It's actually a deformity, and what happens is in the second trimester the foot starts to turn in so that the ankle's almost upside down and the foot is turned over, and you can see it visibly, and if you try and push the foot gently into position, it will only go about halfway to straight. You can't push it all the way out, and some kids it won't even go that far. So it is a stiff, there's a lot of stiffness to it, and it's like the ankle bones have been twisted over, and it's quite easy to see. If you know what you're looking for.
And that's part of what you're doing with STEPS is education, if I hear what you say right.
We've got a very strong focus now that we've met the goal of getting the method accepted in South Africa, because parents are so important in this. Because what actually happens is once the feet have been corrected and they're in position, it's up to the parents to make sure that their child has to sleep in a foot brace, which is shoes attached to a bar, till the age of 4. It's a huge commitment. I always give talks about this, that doctors are actually responsible for such a small part of this, and most of the time the responsibility is on the mother to make sure the feet don't relapse. And what we find is in busy clinics there isn't a lot of information available, and there isn't a lot of time available to explain it to the mothers. So part of our program that we're working on, we have donors from America and another organization also focused on clubfoot called Miracle Feet. They've given us funding, and what we do is we're putting together brochures and pamphlets and things that mothers can take home with them, but also we're going to train in-clinic assistants to be parent advisors. So we're drawing up a training manual for them, which they can then use to talk to either new parents with early stage of clubfoot, how they're going to deal with the casting phase or dealing with the bracing phase, because it fits into 2 different components. And it's a lot to get your head around when you're dealing with a newborn, and now you've got other things to add on to it.
So people can really access you nationally?
Yes.
Okay. And how can they do that?
Well, we've got our website, which is www.steps.org.za.
Okay.
And then you can also call us in Cape Town. It's 021-422-3471. And we can also advise which clinics are closest to you, because not every clinic has a clubfoot clinic. Not every hospital has one. And it's best to get, that was another thing, is it's best to get treated as early as possible. Within the first 2 weeks of life is actually advisable, because the baby's feet are so stretchy and supple, even though the bones are quite stiff, and even in a clubfoot, that you get very fast results. When you get older children that are referred late, it can be more challenging to straighten the foot.
So if you're worried, you definitely just got to go and seek some advice and get some information.
I would recommend to do that, because I've been to quite a lot of clubfoot clinics where people are referred and they don't have clubfoot, but the doctors are happy that at least they've been referred so that they can rule it out, rather than pick it up months later.
Absolutely. Karen, thank you so much for coming to studio and for sharing.
Thanks.
I'm going to give out the website again for people who can get in touch with you, and best of luck for your travels coming up.
Thank you very much.
Thanks
for having me.
Well, that's Karen Moss. She is founder and director of STEPS Charity. And if you've got any questions, if you want to get in touch with her, it's steps.org.za, steps.org.za, or you can phone 021 422 3471. That's 021 422 3471, and we'll put all that information up on our Facebook page, which is otherwise on SAfm. Thank you very much. Well, creativity coach and thinking practitioner, moving on into the last bit of Otherwise today. Hilda Gertzer has teamed up with local